Good morning, Miss Buffet. I'm so glad that you will get to go home today. So during your stay here, we have discovered that you have stable angina. So stable angina is a condition in which the arteries in your heart have become narrowed, which usually is due to something called plaque buildup. So this basically means that you have a buildup of cells that kind of run throughout the body that have collected and kind of narrowed the bloodstream as it's going through. So when you become emotionally upset or like stressed, or when you do physical activity, such as like mowing or something like that, the body is supposed to widen your arteries so that you can keep up with the increased activity. However, with this disease, the arteries narrow instead of widening, which causes several symptoms, including the chest pain that you get. So the chest pain can be a sign of multiple different conditions, and several of which are very serious. So we need you to monitor this pain when it comes. And the doctor prescribes medication to stop the pain, but if it isn't relieved in 5 minutes after taking the medication, we need you to call 911 immediately. It's very important, so I'm going to say that a couple times. So I know you're curious as to why you got this condition. Unfortunately, we don't know the exact reason, but since your husband smokes a lot around you, and you have diabetes, this puts you at higher risk for having the stable angina. Also, people that are older and live with a lot of stress in life can get this disease easier. So you have been prescribed something called nitroglycerin to help prevent your chest pain. The medication works is by widening your arteries so that the blood flow can go past the buildup easier, and the heart doesn't have to work as hard to try to get the blood out. This type of medication has some side effects that we do want you to watch out for while you are taking it, especially during the first few weeks. So just to clarify, you don't drink any alcohol, and you don't take anything for high blood pressure or anything, right? Okay, good. Just want to double check that because this type of medication can cause very low blood pressure when combined with those two kind of things. So the main thing we want you to watch out for is something called tolerance. So this means that your body will get used to the medication easily and it doesn't work as good. So we want you to take this medication only when you have chest pain, and only take one tablet and place it right under the tongue. We don't want you to swallow the medication. But then once again, if the chest pain doesn't go away 5 minutes after taking that first pill, we want you to call 911 because it could be an indication of something more serious, and then take another pill. And if this one doesn't work, you can take one more, but after that, don't take any more. So you can only take 3 tablets in total. So when you take this medication, it may cause a headache, but that's pretty normal. It should go away about 20 minutes. Also, when you take this, be sure you're sitting down because it can cause you to become lightheaded and maybe almost faint. It could cause that too. So, but that is pretty normal. So if you have any problems with any of these symptoms, call us and we can change the way you're taking it. We can give like oral or put it as a paste on your chest, that kind of thing. Or we can try to come up with some other kind of medication for you. So we will have you come back in a couple weeks to make sure you aren't having any more chest pain, and if you do, how well the medication is working. I know that was a lot of information at one time, but can you tell me what you're going to do when you get home? All right, thank you.